Welcome to the EAACI Day of Immunology. My name is Eva Untersmeyer-Elsenhuber. I'm the chair of the Immunology section.
And my name is Milena Sokolowska, and I am secretary of the Immunology section.
We are very happy that you are interested in immunology and research about the immune system. Therefore, we have prepared cartoon videos highlighting burning topics like food allergy, vaccination, and COVID-19 for you to summarize knowledge that is available. Additionally, we have invited today experts on these topics to discuss important information. We hope that you enjoy all these activities, that you get new information, and we hope that you will still remain interested in immunology research.
Please enjoy the World Immunology Day with us.
So we are now welcoming Wojciech Falesko and Thomas Eiwecker, both professors of pediatrics and chairs of EAACI working groups. We are now discussing vaccinations and vaccines. We hear about it almost on a daily basis these days. Wojciech, are vaccinations a true success story?
Well, in my perception, this is a tremendous success. We witness a real change in our attitude to some infectious diseases. Even in the last 20 years, we have seen success of several vaccines that have been distributed and provided to our patients. We just don't see some diseases that we have learned during our medical studies, for instance, invasive pneumococcal disease or Haemophilus influenzae, epiglottitis. We don't see it anymore, which was a real true of every pediatrician like 30 or 40 years ago. So I want to stress that these diseases really disappeared from the spectrum of our everyday clinical life, which I consider as a huge success.
Okay, thank you, Wojciech. And because we are the Allergy and Clinical Immunology Society, I am obliged to ask, and I'm asking Thomas, what about allergic individuals? Usually they are afraid of vaccination. Are there any considerations for allergic adults and children regarding vaccinations in general?
Thank you very much for this important question. So in general, there are no important considerations for allergic individuals. Every vaccine that is applied is supposed to be applied by a specialist, and there should be a minimal observation time afterwards to be able to react. The risk of having an allergic reaction is extremely low. It is in a normal setting, it is about 0.1 to 1 in a million vaccinations applied. And in some of the COVID vaccines, it is a little bit higher, but still in about 1 to maximum 10 in a million. And the very important message also is, if these reactions occur in a setting where a doctor is present, these allergic reactions can be managed. And this was also the aim of our position papers that we published together to really point out the importance of applying vaccines for all kinds of diseases which we have available, because the benefits by far outweigh the risks.
Thank you very much. You already mentioned COVID-19, and the pandemic has turned our world upside down. So what about barriers in getting vaccinated and the perception of the vaccine itself? So this goes to the both of you. What would you consider important in this aspect?
Yeah, well, what I believe it happened in the last, let's say, 10 or 15 years is that due to the fact that some diseases really disappeared from the broad social perception, some parts of the societies believe the vaccines are no more necessary nowadays. And these opinions are distributed mainly through the internet and social media, and are sometimes supported with very high load of negative emotions. So if you go on the internet, on a Facebook or Instagram, and you look about the anti-vaccine opinions, you realize that they don't show any real scientific data. What they show, these are individual stories raising negative emotions against vaccines. So what I strongly believe we need nowadays as a EAACI and any other scientific societies is to vaccinate societies against anti-vaccine movements via providing real scientific data and raising positive emotions towards vaccines.
Absolutely. I completely agree with you. I think it is very important to address these barriers that we are facing and also to take them serious to a certain extent. The one thing is we have structural barriers like how difficult is it to get access to a vaccine? Does it cause costs which for some parts of the society are difficult to manage? It's also the time factor when we're talking about children and parents have to take time off to get the vaccinations. We have to facilitate this as a society by making sure that the governments are actually setting the right actions to make these to tear down these barriers. And then we have these attitudinal barriers like that are created by misinformation, by a lack of information. And this is obviously a strength of our society, that we create position papers that really address this lack of information. And then we have this lack of trust in some groups, in minorities, and also in some parts of the society. And that needs to be addressed by very, individual approaches and not by implementing laws that vaccination needs to happen. We have to address that. And there will always be a very small part of the society left out who would reject any kind of vaccination. But I think the vast majority of our society is very much in favor of the idea that we defeat these infectious diseases and keep our children safe at the end of the day. Yeah.
Thank you very much. This is, I think, a very important summary, which we should agree at the end. As an immunology society, as an immunology section, we have to admit that vaccinations are one of the best immunological and actually medical invention of the last several years. So we just have to vaccinate, and I think we all agree here. And thank you very much for this session.
Thank you very much. And I hope that everyone also enjoys looking at the EAACI cartoon movie on vaccination to get more information about it. Thank you.
Thank you.
In the past, many children and adults died for unknown reasons. Not understanding why, people often blamed the supernatural or bad luck. Finally, science stepped in and discovered the real causes. And we realized that many of these deaths were due to infections caused by microscopic germs. During all this time that we were unaware of their existence, these tiny germs easily infected, killed, or crippled huge numbers of people. But after many years of research, we discovered that we can protect ourselves through vaccinations. It is very important that they are available for everyone. But how do vaccinations work? A vaccination is a way to teach our immune system to detect harmful organisms and protect against them. Vaccines contain harmless fragments of germs, which are recognized by the immune system but cannot cause an infection. After the vaccine is injected, containing an additional vaccine substance, called adjuvant, it alerts our immune system of its presence. After investigating the intruder, our cells start attacking immediately. When the battle starts, some of the T cells and natural killer cells directly destroy the intruders, while other T cells instruct the B cells what kind of intruder they're dealing with. The B cells are the weapon factories of our immune system and produce antibodies which bind very specifically to targets on the intruders to eliminate them. Additionally, our immune system develops memory cells that help our immune system to be prepared and to react instantly when it encounters the same intruder again. So the next time the body gets in contact with these germs, we can rely on our own trained and tougher immune system. Due to the protection given to us by vaccines, we do not get severely sick, and we do not spread these infections to those whose immune system is not strong enough. For example, small babies, pregnant women, or people sick with other disease. By making sure that at least 95% of people are vaccinated, the remaining 5% who cannot be vaccinated will still be protected. This is called herd immunity. By working together, we have managed to change things in a relatively short time. Due to vaccinations, 3 million children are saved every year. With higher vaccination rates, an additional 1.5 million children under the age of 5 could be saved. But there are signs of the clock turning back, with people choosing not to vaccinate, disrupting the protection of the population, the herd immunity, risking not only their own lives, but also the lives of their newborn babies and all other unprotected people. All because of wrongly perceived risks and falsely claimed side effects. We know that vaccines can cause mild side effects like fever and headache. But if you look at the risk of death from infections because of not vaccinating, these side effects are worth it. With huge amounts of resources and time spent by researchers all around the world, studying large groups of people, it has been proven time and time again that there is no association between vaccinations and allergy development, autoimmune disease, or autism. Although the scientific community has shared these findings directly with the public, through rigorously checked scientific reports and renowned websites, there are still people who share and spread urban myths and fake news about vaccines. So before you click on popular but unfounded sources spread by non-specialists, consult a medical expert or an approved medical resource and benefit from the lessons learned by our ancestors. For more information, please go to patients.eaaci.org.
Now it's my pleasure to welcome Milena Sokolowska, Secretary of the EAACI Immunology Section and Medical Specialist in Internal Medicine, Anna Sediva, Chair of the EAACI Working Group on Immunodeficiencies and Medical Specialist in Clinical Immunology, Mohamed Jamshi, Chair of the EAACI Research and Outreach Committee and Immunologist, Oliver Pfarr, EAACI EXCOM member and ENT specialist, and Berber Flich-Brostra, who is a nutritional specialist. And we will discuss now the very important topic of COVID-19. The last year has perfectly shown that immunological research is fundamental to understand diseases and to find treatment options. Milena, during the course of the pandemic, what have we learned on how the immune response to SARS-CoV-2 differs between individuals?
Thank you, Eva. Indeed, during the course of the pandemics, we learned a lot how immune system is important in the worldwide level. And immune responses to SARS-CoV-2 infection can vary hugely between different people. So we all seen is that some people have a very effective immune response, so they can successfully fight off an infection and they don't have any or very mild symptoms. And now, after more than 1 year of pandemics, we know that this is connected to some extent with the expression of the molecules which facilitate viral entry to the airway cells, with the efficient immediate immune response to the virus in the airways, and also with the special type of cells, lymphocytes B, which are making special type of antibodies, IgA, which neutralize the virus already in the nose, throat, and lungs. But also the course of COVID-19 and its severity differs between people. People with the most severe disease, due to the most recent data, we know that they have a lot of activated and proliferating cytotoxic lymphocytes, but also quite unexpectedly a lot of monocytes and platelets and a lot of pro-inflammatory mediators. And all of this constitute this over excessive inflammation in those patients and leads to respiratory failure and multi-organ disease. And then after the course of COVID, as a natural disease, people also vary significantly in the number of antibodies and in the number of cells which are developed to SARS-CoV-2. Therefore, in contrast to vaccination, where the dose of the vaccine is similar and the memory response is more or less predictable, although still variable, a natural infection may or may not constitute a long-lasting immunity. So everyone should get a jab.
Mm-hmm. And the question is now, how long does the immune response last after an infection? What is known about this?
So because we are now 1 year after more or less the beginning of the pandemics, we know that the natural antibodies against SARS-CoV-2 decline moderately after more or less eight months. And B cells, so those special lymphocytes producing antibodies, they increase between 1 to 8 months, and memory T cells slowly decline with an initial half-life about 3 to 5 months. But it does not mean that the end of immunity. So because on the subsequent exposure to the virus, due to this potent immunological memory, these responses are much faster. So there are a lot of ongoing studies to explore how long in longer time points this immunity will last.
Mm-hmm. Anna, now I'm asking you, why do children not experience severe symptoms, no, normally not experience severe symptoms with COVID-19?
Yes, indeed, it is really, for me, it's very fascinating how this virus distinguishes between pediatric and adult population. And children are really experiences much less severe disease, and the reasons for that are probably very complex. First, the immune system in the childhood is developing under the pressure of infection, and children are very much used to fight the infection very efficiently. Concerning COVID-19, we think that the children have less receptor for the virus, especially in the lungs. So the load of the virus is not so strong, and they are very, very efficient in limiting the infection to the area of entry, mostly with innate immunity, probably in the nose and throat. And they do not progress to the severe disease. And also they are not prone to the severe cytokine storm or severe infection that causes major complications in adults. We also think that maybe children have some previous protection from encountering common coronaviruses that are quite frequent among children, and they are not SARS-CoV-2, much less serious, but they were around several years before already.
But some children do have severe symptoms. So what is this multi-system inflammatory syndrome, and how is it really connected to the disease?
Yeah, it's actually quite frightening. It's quite severe complication, but I must say that it is very, very rare, and it affects only some children. And we now cannot predict who and which children will be affected, but it seems there is some genetic predisposition to this complication. It is important to know that it is not the infection itself, but it's the immune reaction, inflammatory and autoimmune reaction that is after the infection, with the delay of approximately 4 to 6 weeks. And the syndrome is very complex, severe, with high fever and with high inflammation and organ involvement, especially cardiac myocarditis, and some other might be frightening for parents, but it's good to know that now once the syndrome is recognized, it has an excellent prognosis with the proper treatment. And that is really fascinating thing, and we are having very intensive research line around it, and we are expecting really very exciting results in the future.
We look forward to
teach us about immunity and autoimmunity.
Yes, we look very much forward to it. We are also an allergy society, so therefore also in this situation in the pandemic, we have to think about allergies. And patients with asthma are treated with biologicals, which are antibodies or small molecules that interfere with the immune response. Might this treatment also impair the immune response and therefore also the protection against COVID-19?
Well, Eva, thank you for asking this very important question. Well, firstly, there is no any evidence which suggests that immune response to COVID-19 will be impaired in asthmatic patients who are receiving biologicals, and this could be in a context of anti-IgE or anti-IL-5 receptors and so on. Secondly, in the absence of any data indicating a potential for harm, it would be reasonable to continue to administer biological during the COVID-19 pandemic in patients, particularly for whom such treatments are clearly indicated and are very effective.
So what is important to know for patients who are under biological treatments in the context when they have COVID-19, or what do they have to consider for their safety?
Yeah, another very relevant question, and also something that's very much projected by the position paper, the EAACI position paper that came from the immunology section that you are chair, and the working group, the biological working group. Well, firstly, in the event of no infection, the recommendations are firstly to maintain biological treatment, and if self-application is possible by the patient, then there is a need to follow this up by telephone and via telemedicine. Mm-hmm. In the event of infection, there are two examples here. So firstly, in asymptomatic patients, the recommendations are to withhold treatment for 2 weeks until they recover and have a negative swab test. And then the important thing here is to maintain intense asthma medication. Secondly, in patients with severe or critical infection and who are at the hospital, the recommendations here are to withhold treatment for 2 weeks until recovered and have, again, a negative swab test. And then following that, an acute management of respiratory distress symptoms is very important. And so finally, once fully recovered and there are no infection, the key element here is to reestablish pre-infection treatment. And this, of course, includes assessing allergic disease severity.
Mm-hmm. Thank you. So we are in the middle of discussing treatment for allergies, and allergen immunotherapy is the only disease-modifying treatment that we have. And of course, during the pandemics, we as medical doctors asked ourselves, is it safe to continue? Oliver, what were the EAACI recommendations, or what are the EAACI recommendations during pandemic, or when we were getting, or patients were getting COVID-19? So what can you tell us about this?
The EAACI has promptly reacted to the so-called first wave in 2020 and published a position paper on this. So our recommendation was that both subcutaneous as well as sublingual immunotherapy can be continued during the current pandemic in asymptomatic patients or patients without suspicion of a SARS-CoV-2 infection. However, in case of COVID-19 diagnosed or suspected cases, an interruption has been recommended. However, if these recommendations were conditional, as we simply didn't have data from clinical trials, we didn't have real-world observations at that time. So this was a consensus recommendation based on expert consensus. Mm-hmm. However, this was not based on data out of the field.
And do we now have this data that support these recommendations?
Yes, in July 2020, the EAACI launched a worldwide survey of for AIT practitioners, and we asked them about their experience with AIT and the COVID pandemic in real life. A total of 417 healthcare providers answered them all over the world, and the key findings were: first, AIT has been found to be safe during the pandemic. And this was the case for both application forms of AIT, so sublingual and subcutaneous immunotherapy. So again, these real-world data revealed that there's no justification for the interruption of AIT in asymptomatic patients. However, this survey also unveiled that there is a high degree of undertreatment of AIT worldwide. And this problem has also been found in many other areas in medicine. And this undertreatment may have a long-lasting negative impact on the clinical care of allergic patients in the future. We will see.
Mm-hmm. Nutrition is an important factor to support the healthy immune response. Berber, are there nutrients that we can include in our diet or that we have to supplement that can protect us against viral diseases?
Yeah, thank you for this question. This is really a relevant question. Therefore, a task force of the EAACI last year has performed a literature study to study if it's useful for healthy individuals to take supplements to increase their resistance and to improve the protection against viral respiratory infections such as COVID-19. Because indeed we know that specific nutrients are involved in the immune system and can boost our immune function, or are essential for our immune function. But our conclusion was that supplementation of vitamins, minerals, or fatty acids in the general healthy population has no, or at most very limited effect on the prevention of viral respiratory infections. There was some evidence that vitamin D in certain groups of adults may have very small protection, but that's not what we found in all world regions. And how did we come to this conclusion? Well, first we studied the nutrients which are known for their effects on the immune system, and these were the vitamins A, C, D, E, folic acid, vitamin B12, multiple micronutrients, beta-carotene, zinc, iron, and polyunsaturated fatty acids. That were the nutrients we studied. And then we only studied the papers where they studied the effects in a high quality way. And we studied the literature in a very systematic way. And we only included studies where the effects were compared to placebo. And then we pooled all the results together and weighed the evidence in so-called meta-analysis. And we studied the effects for adults and children and world regions separately. So we didn't find major results. And our conclusion is that taking bottles of pills will not or very little help the healthy consumer to protect against respiratory viral infections. In contrast, based on what we know today, we would rather advocate a healthy, anti-inflammatory diet and lifestyle to enhance our immune system for better protection.
Thank you all very much for these important statements and for sharing the information with us and with the EAACI members. And now I hope that everyone enjoys watching also the EAACI cartoon video on COVID-19. Thank you.
Thank you very much. Thank you, everybody.
Thank you. Thank you.
The COVID-19 pandemic that has shaped our new reality is a result of ever-increasing human intrusion into habitats of wild animals and the close interaction with them. The SARS-CoV-2 virus jumped the species barrier and sparked the first human COVID-19 infections. Global mass travel fueled one of the most explosive pandemics in modern history. The COVID-19 virus affects people in different ways. It enters a human host through the eyes, nose or mouth, via droplets or aerosols, or through contact with an infected surface. The mucosal immune system can be strong enough to fight off the virus, resulting in no symptoms or moderate symptoms that include a fever, cough, tiredness, and lack of smell or taste. Symptoms usually appear within 5 to 14 days. While most people recover without hospital treatment, the long-term effects of mild disease are not yet known. It is therefore crucial to stay at home and to minimize contact with other people. If your mucosal barrier is breached, the virus spreads from the nose to the lungs. Your immune system becomes activated as T cells and B cells work together to produce potent antibodies to neutralize the threat. The immune system may also become overactivated and cause inflammation and vascular clots that can damage the lungs. If the immune cells become exhausted, they can no longer fight off the virus efficiently. The virus causes fluids to build up in your lungs, preventing them from filling up with enough air, which decreases the oxygen in your bloodstream. The disease may then progress to a critical stage of acute respiratory distress syndrome, followed by multi-organ failure, which leads to death in most cases. Although the data point to a range of health profiles and pre-existing medical conditions among the majority of deceased patients, this does not exclude the risk for other people. Research aims to gain insights into the underlying molecular mechanisms, such as ACE2 and other SARS-CoV-2 related molecules, to understand how the virus works and to improve our protective immune response to it. This will help us to understand how to prevent and fight the infection. Highly infected areas tend to have crowded environments, a lack of preventative measures, no social distancing. To detect which individuals are infected, 3 types of tests are currently available. The most commonly used are PCR and rapid antigenic tests. Both only reveal if you are infected at that moment. This prompts the need for regular testing among key populations. An antibody test to detect SARS-CoV-2 antibodies in your blood can usually reveal if you've had the virus in the past. Large-scale testing can help to slow the spread of the virus. However, the most effective methods start with you. Follow the medical guidelines, which are also essential for controlling other highly infectious diseases. Practice social distancing. Ensure good ventilation. Wear masks in close quarters and wash your hands. The development of antiviral drugs and the implementation of COVID-19 vaccines are already in progress. We have to remain vigilant for patients with chronic diseases. It is important to continue inhalers and other treatments, to attend regular medical checkups, and to immediately notify a medical professional when symptoms worsen. As European immunologists and allergists, we will continue our scientific work to aid in the global effort to find the best clinical solution for patients with allergies, asthma, and immunodeficiencies. For more information, visit patients.eaaci.org.
Hello again. Today and now I have a pleasure to introduce the next topic of the World Immunology Day, which is food allergy. And as we all know, food allergy, as also the other allergies, is increasing in the whole world. So this is a very important world problem. Even or especially now during the COVID pandemics, but this will not go away after the pandemics. So I have a great pleasure to introduce 3 great speakers for today's meeting. Alexandra Santos, who is an associate professor, specialist in pediatrics and allergy at King's College London in UK. and also Professor Liam Mahoney, who is a professor of immunology at the EAACI Microbiome Ireland, National University of Ireland in Cork, and Professor Eva Untersmeyer, who is a professor and a specialist in clinical immunology at the Medical University of Vienna. So, Alexandra, how can food allergies be diagnosed?
Hi, Milena. Thanks for having me. So there are two types of food allergies, depending on how soon they present after exposure to the allergen. So we talk about IgE-mediated food allergies, which are immediate. So they happen up to 2 hours after exposure to the allergen. And these can be diagnosed based on the symptoms of the patient and allergy tests, which look for evidence of IgE antibodies, so the allergy antibodies directed to that specific food allergen. If this is not enough to confirm the diagnosis, then we need to do oral food challenges, which consist in giving the food to the patient in a supervised environment, in a medically supervised environment, starting with very small amounts and building up to an age-appropriate portion. The non-IgE mediated type allergies, so the ones that are presented in a delayed form after exposure to the allergen, so after 2 hours or more after exposure to the allergen, or they can manifest chronically, there is no allergy tests. So the diagnosis is based on the history and then the response of the patient to elimination diet and reintroduction of the food in the diet.
Okay, thank you. This was very comprehensive definition. And so what is the treatment for someone with a food allergy?
Thank you. That's an important question. So there is no curative definitive treatment for food allergy. And the mainstay of management is allergen avoidance and an emergency medication to treat acute allergic reactions in the context of accidental exposure. Now, allergen avoidance requires a lot of patient education about reading labels, names that allergens can have, and an appropriate replacement of these foods in the diet. There are other treatments, more specific treatments being researched at the moment. One of them is allergen-specific immunotherapy, which consists in giving the allergen that the patient is allergic to in a specific schedule in order for the patient to become desensitized, so becoming less sensitive to the allergen. And there's recently a product that has been approved for the treatment of peanut allergy by FDA and EMEA. And there's also biologics being researched at the moment for treatment of food allergy, but it's not yet available in clinical practice.
Okay, thank you very much, Alexandra. So maybe we continue with food. We are also eating and giving food not only to ourselves, but also to the millions or billions of microorganisms which are living inside us. So Liam, would you explain us what is the microbiome?
Yes, thank you very much for this question. So the microbiome refers to this wonderful community of microbes that we have living in us and on us. And, you know, we've only really recently recognized that there's this huge number of microbes in us and on us. It's just as many cells as are present in the human body that are human, that are microbial. And all of the genomes associated, all the genetic material associated with these microbes is 100 times more than the genetic material that's present in human cells. So this is a really fascinating and exciting frontier in modern research and clinical research, because we're really only discovering what is there, what it's doing, and how it's connected to immunity, metabolism, and health in general.
Yeah, great. And then, so what can you tell us about why is the microbiome important for food allergy?
So some very recent findings have shown that the microbiome is different in people with food allergies and often can be different even before the symptoms are manifest. And so this is a really important area of investigation now to understand how the microbes might influence sensitization to foods or protection against food allergies. And I guess the area that we're really focusing on is that we feel that we are missing some microbes that we used to have in times past through having a very varied and diverse diet or diverse exposures to a very biologically rich environment, which we don't have anymore. And then we miss some microbes that drive immune tolerance mechanisms, and then this allows for manifestations of aberrant sensitizations like the food allergens. So that's the hypothesis that we're all thoroughly investigating currently.
Okay, thank you. It's really fascinating. And may I ask Eva to follow on the topic? What is known about the role of the intestinal barrier in food allergy?
Thank you very much, Milena. I think this is an important question because all our surfaces in the human bodies are protected as they are surfaces to the external environment. And we just heard about the microbiota. They are also part of the barrier and they have an important function there. But there's also the mucus, the epithelial cell layer, and the immune cells that are part of the gut barrier and that are very important. And there are also antibodies and molecules secreted that are protective. The leaky gut, in the contrast, as the impaired barrier is often called in lay media specifically, is associated with a large number of diseases. And one of the diseases that we know that is associated with an impaired barrier is food allergy. We know today that the barrier, the gut barrier, has to be permeable as nutrients have to be taken up. And a certain permeability is important to train our immune system. The question is, how much is too much? So the too much exposure to antigens is not good for the body's health, as inflammation might be the result. So with more immunological research, we need to understand how much is too much with regards to dysfunction of the barrier and how we can improve the barrier function, specifically in the gut. Professor Jasmiaktis from CIAF Davos has some additional information on this topic for us.
Thank you very much, Eva, for the invitation. On this day of immunology, my contribution is going to be on mechanisms of allergy development and effect of environmental factors. We have recently published this paper, which we are really happy to introduce the concept, the hypothesis of epithelial barrier on the development of allergic diseases and autoimmune diseases. And in epithelial barrier damage, we have a lot of factors from the environment which have started to influence the barrier since 1960s, and they became very dominant to affect the barrier, like laundry and dishwasher detergents. Many of them were introduced in 1960s, household cleaners, surfactants in detergents, ozone, nanoparticles, enzymes and emulsifiers in processed food, particulate matter, and microplastic. And some of them are really affecting the respiratory system, like diesel exhaust here, particulate matter here, inhaled detergents. And some of them are affecting the gastrointestinal system. Specifically here we have enzymes and emulsifiers in processed food, and microplastic and nanoparticles if we are ingesting them. What happens is that we can see the epithelial barrier here, and the microbiome gets deeper between the epithelial cells and starts to contact the epithelial stem cells, basal epithelial cells, and also contacts with the immune system. And the microbiome translocates under the epithelium. Then we have a change of microbiome and the strong microbial dysbiosis is taking place in the lung, in sinus, in the gut. And there's colonization of opportunistic pathogens like Staph aureus, Moraxella, Haemophilus, and Pneumococcus. Then we have these activated cells migrating to further far organs. And these are, here we have the lung, and from lung and from gut, there's a migration to skin, like the CLA, positive skin homing T cells, which we have worked, and first time most of the studies were done in our institute in 1990s. And we have also other cells that migrate to brain to make multiple sclerosis, to joints, to make rheumatoid arthritis. So the epithelial barrier hypothesis is summarized here. There's exposure to barrier damaging agents. Then we have inflammation in the epithelium, followed by colonization of opportunistic pathogens, and then microbial dysbiosis is taking place, and translocation of microbiota to subepithelial areas is taking place, and an immune response starts. Immune response to Staph aureus starts together with immune response to commensals, and immune response to Moraxella, immune response to Haemophilus. Together, there's an inflammation starting around the epithelium, and then the epithelium does not heal, and there's a chronic leakiness, and defective epithelial barrier is continuing. So I would like to stop here by showing that these mechanisms affect currently more than 2 billion patients, the whole allergy environment, and also the whole autoimmunity environment. Thank you.
To grow healthy, you have to learn, eating all kinds of different foods. This should include fruits, vegetables, and whole grain cereals, as well as protein foods such as meat, fish, dairy, eggs, nuts, seeds, and pulses. Look, let me show you. When I was born, it was important for my health and immune system that my mum breastfed me. From 6 months, as well as breastfeeding me, my mum also started introducing me to all kinds of different healthy foods. This meant I was eating a great variety of foods just like mum and dad, and so got all of the protein, calories, vitamins, fibre and minerals I needed. As well as being fun, experimenting with lots of healthy foods, eating foods like peanut and egg early on helped to stop me becoming allergic to them. I thought everyone ate like I did, but I noticed some of my friends, like Kathy, always preferred to eat the same food, whereas my lunchbox was always full of different foods. I knew that a healthy diet should have variety, with fruits, vegetables and whole grains being the most important foods. So why didn't everyone eat this way? I couldn't understand how eating only a limited number of foods could be healthy. Our teacher explained how all of the different nutrients in foods, including protein, healthy fats, vitamins, fibre and minerals, could affect our immune system. She also told us that the balance of different bacteria in our gut is called the microbiota. Eating lots of healthy foods helps our microbiota by providing the right fuel for the good bacteria in our gut. So trying many different healthy foods early on and avoiding unhealthy foods high in fat and sugar gives our immune system the best start in life and helps prevent allergic diseases. Just like a bus needs not only fuel but also oil and water to run properly. So to keep our microbiota healthy, we don't just need calories and protein, we also need vitamins, fibre, iron, calcium and micronutrients. A healthy microbiota and the early introduction of foods also helps our immune system not to see these foods as a threat. My friend Kathy's diet has always been limited, so not only is she missing out on important nutrients, her restricted diet might also affect her gut microbiota. Because I have always eaten a good variety of healthy foods since I was a baby, my gut microbiota are healthy and I'm less likely to get allergies. So as I got older, I experienced even more different foods, which helped me get stronger, mindful, resilient, and certain about what is good for me. So now it's your turn to experience even more than I did. Open wide. For more information, see the EAACI website for details. patients.eaaci.org